Hi everyone. In this module, we'll learn about infant health and COVID-19. COVID-19 can be scary. Some newborns have tested positive for COVID-19 shortly after birth. However, most infants had mild or no symptoms, and only a few newborns have developed severe symptoms. Guidelines are always changing, but to keep yourself and your baby safe and healthy during the pandemic, please follow the current recommendations, including wearing a mask, staying 6 feet apart from other people, avoiding crowds, and getting your vaccines and booster shots. While it may be appropriate for you to wear a mask, it's important to note that the Centers for Disease Control and Prevention does not recommend the use of face shield or mask on your baby because this can increase the risk of sudden infant death syndrome. If you have other children younger than 2 years of age, they also should not wear masks. To protect your new baby, it's usually best to limit visitors. Bringing people who do not already live with you into your home can increase the risk of spreading COVID-19 and other illnesses. Even if people do not appear sick, remember that people without symptoms can still spread COVID. Everyone wants to meet the new baby, but it's best to limit in-person gatherings and consider other options to see your new baby, such as virtual chats or get-togethers. When people do visits, please ask your guests to stay 6 feet away from you and your baby, wear a mask, and wash their hands when visiting your home. If you go out, it's best to avoid crowds and poorly ventilated spaces. Now, let's learn about signs and symptoms of COVID-19 infection in babies. This may include fever, runny nose, cough, vomiting, diarrhea, poor feeding, shallow breathing, and weakness. If you think your baby may have been exposed to COVID or your baby is ill, please contact your baby's healthcare provider. And if you observe warning signs such as trouble breathing, seek emergency care immediately. If you or your baby are sick, breastfeeding can and should continue. If you are sick, you can wear a mask and wash your hands before touching or feeding your baby. If you do not feel well enough to care for your baby, you can pump as often as possible to maintain your supply. And a healthy caregiver can give your milk to the baby in a bottle while you recuperate. Some mothers are concerned about getting the COVID-19 vaccine while breastfeeding. Research is being conducted, but because pregnant and recently delivered mothers are at a higher risk for severe illness from COVID, it is recommended that pregnant and breastfeeding mothers receive COVID-19 vaccinations and boosters. It's safe to continue to breastfeed after receiving the vaccine. Speak with your healthcare provider if you have any questions. Thank you for listening.